So thanks, Brian, for that introduction. In fact, you're absolutely right. I talked to Atapol when he was giving his talk at the meeting last year, and I arranged a visit en route to Japan for another meeting that I was invited to. So it was a very enjoyable experience. Now, I appreciate this all seems like a bit of a holiday snaps travelogue, but I'm going to do my best to keep it seriously. So, I mean, just the background, and I think everybody here is aware that liver flukes, especially OV, are endemic in some parts of Asia, and particularly the Mekong River basin. And the fish are eaten sometimes raw by the population, and always have been. And because of this, the incidence of perihilar cholangiocarcinoma is extremely high in this area. Hence the excellence in surgery and in the screening program. So, just starting my travelogue. So this is Konkeen, quite a nice city with a beautiful temple, which I visited just after getting off the plane after 24 hours of travel. So it maybe would have seemed a bit better with a little bit more sleep, but a great experience. And here is the team, and Atapol was my host. Now, this is the itinerary. So day one was surgery for perihilar cholangiocarcinoma, which I will show you. The second was a screening program, and what they tend to do is they arrange a bulk screening at factories and such like. And I was heartened that we were going to a beer factory. Unfortunately, the beer shop was shut, so that did not achieve the desired objective. So, firstly, I really did not know what to expect about the hospital, but actually, it's a superb facility and very similar to a lot of European academic medical centres. Very modern, up-to-date equipment. And in theatre, I'm sure Brian's got this at the beautiful wall that gives you feelings of general relaxation and such like. But we certainly don't have that, and it is very welcome if you're doing an 8-hour operation. The imaging is actually generally better than ours, and this is some nice, I think, Siemens software that allows you to do the liver segments. And this is the patient we operated on. You can see the tumor here. So it's a very impressive standard of surgery. I mean, they're doing cholangiocarcinoma, hilar cholangiocarcinomas every week. So they are really, really good at it. Very meticulous dissection, very low blood loss. Though I have to say, if we also were able to operate on patients who were nice and thin, it would actually make our surgery a lot easier as well. I've got a video of it. If anybody wants to borrow it, I can send it, although it is multiple gigabytes. So interesting. This is a tumor. There is a good resection margin. They tend to look like this, which we don't tend to see as many of these tumors that are sort of lumps within the duct are sort of usually infiltrative along the duct, but this is apparently quite typical of the sort of disease that they see. So moving to the screening program, it's a very formal program, and it includes education for all of the people being screened. They get their antibody blood tests, and if it's positive, they get the medicine. They all have an ultrasound of the liver, and for any patient that has got a significant abnormality, they would go on at a later date to get a CT. And this is a show they put on with the carp, the parasites, and then what the liver looks like when you've got a bad cholangiocarcinoma. This one is not an operable. This is not operable disease, nor ever was. They get the antibody tests, and can I introduce to you our next speaker, who's actually only on video. This is Professor Loromi, who is Professor of Biochemistry and is director of the CCA Institute, and you'll see her in a number of these pictures. So this is the population that's being screened, sitting comfortably. They then get their ultrasound, and anybody who's got an abnormality, as I said, will go on to CT. And I think there were 3 patients in this screening session who turned out to have an abnormality who went on to get a CT. So, in conclusion, it's a world-class clinical service for the treatment of cholangiocarcinoma, combined with a research program. The unique prevention screening program is in a high incidence area, and as I said, in this instance, there were a few lesions picked up from this one screening episode that went on to CT. We can't do this anywhere except in an area which has such high incident, but certainly in Thailand, this is really important. So I got the T-shirt. In fact, I got 2, and it was a great visit. And I think I will certainly encourage some of my surgical colleagues to go and look at the surgery, because it is outstanding. So, thanks so much.